Welcome, everyone, and thank you for joining us this morning on the first official day of summer. Hopefully, it is warm and sunny where you are. Today, we are delighted to have Dr. Mary Davis, Chief Medical Officer for Security Health Plan, with us to present on navigating diabetes and living a full life. She will cover the risk factors and discuss the support available for those who may be at risk of or who have adult onset diabetes, also known as type 2 diabetes. Oof. Dr. Davis will touch on the importance of preventive screenings, controlled blood sugar, routine vision exams, and the resources available exclusively for Security Health Plan members. Dr. Mary Davis is a fellow of the American Academy of Family Physicians and has served as a chief medical officer and medical director consultant for several years. She earned her medical degree at Temple University School of Medicine and completed her residency at the University of Wisconsin-Madison. She practiced family medicine in Columbus, Wisconsin before transitioning to administrative work. We've secured an expert for today's conversation, and we're looking forward to her sharing this important information with our audience. Alrighty, Dr. Davis, the floor is now yours. Take it away.
Thanks so much. Hi, everyone. I'm looking at this title and reflecting on the fact that I'm over 65 and how to live my best life is a challenge for me every day. I don't know how the rest of you might feel about that, but the title might be a little overly ambitious. Can we go to the next slide, please? So this is what we're going to talk about today: what diabetes is, what kind of screenings you should do, how you prevent diabetes, how you live with diabetes, and then I want to focus for a few minutes on the support systems that we have if you are at risk for diabetes or you are diabetic, that Security Health Plan offers you at no charge because you are a member of our Medicare Advantage plans. Next. So you heard in the introduction at least two names for diabetes. There's type 1 diabetes, which is not what we're going to talk about today. I'm going to talk about type 2 diabetes mostly. It's also called non-insulin diabetes, NIDDM, insulin-dependent diabetes, high sugar. There are tons of names for this. I'm going to try and refer to it consistently as type 2 diabetes because it's a different disease than type 1 diabetes. Type 1 diabetes, you are not producing insulin, and without insulin, you cannot survive. That's not what I'm talking about. I'm talking about later stage, typically diabetic states that are often called adult onset. So I just wanted to make sure that we were all on the same page about the kind of diabetes I was going to talk about. Next slide, please. So I'm talking about type 2 diabetes. So what is it? You either don't make enough insulin, so your pancreas is sort of pooped, or your body doesn't use your insulin well. There are some chemical barriers to using that insulin that is produced, and so you are resistant to that insulin. What that means is that insulin is what drives your sugar, your blood sugar, your glucose to your cells where it's needed as energy to make your body work. And therefore your blood sugar, the sugar in your blood, is too high. And that leads to all sorts of different problems. And so controlling your blood sugar is key to success with managing your diabetes. Next. So if you don't manage your diabetes, there are multiple issues and multiple disease states that we consider a complication of diabetes. If you didn't have diabetes, you'd be far less likely to have any of these problems. You can have heart disease, nerve damage, kidney disease, dental problems, bladder problems, eye disease, foot problems. You can have a liver disease called non-alcoholic fatty liver disease. If you're overweight and you have diabetes, you can get sleep apnea. And it's linked in some cases to some kinds of dementia and some kinds of cancers. So this is a chronic disease, non-curable, but certainly treatable, that if you don't pay attention to it can lead to some pretty miserable end stage problems. Next. So who should be screened for diabetes? Because that's really the most important part, is detecting it if you have it and making sure that you're being screened appropriately if you don't have it, but are at risk. So this slide talks about who should be screened. So anybody who's 35 to 70, who is overweight and has a first degree relative, mother, father, brother, sister with diabetes should be screened because you're at higher risk. People who are in the Asian, Native, and African American populations, Pacific Islanders, Hispanics, of any type, without a designation of being overweight, we know these populations have a much higher rate of diabetes, and they should be screened. And women who had something called gestational diabetes, which is being in a diabetic state when they were pregnant, but the diabetes disappears when they're not pregnant, they have a higher risk of later stage diabetes, later in life diabetes, I should say. And how often should you be screened? Every 3 years, if your tests come back normal. And if your screening is abnormal, you may need to be tested more frequently. Your test may show that you are something called borderline diabetic, or your test is not in the normal range, but not yet diabetic. And so your doctor will want to screen you more frequently than every 3 years. Next. Okay, so there is good news. We have lots of treatments and lots of things that you can do yourself under your control to help prevent diabetes. And if you have diabetes, from having a foundation for making sure that you do well with your diabetes and you don't get any of those complications that we talked about earlier. So the basis of all of this is lifestyle. And I know how hard that is. During COVID, I, like a lot of my peers, gained a lot of weight. And my screening test for diabetes went up because I have 2 brothers with diabetes. And they were diagnosed in their 40s. So I have to be very careful. So weight gain put me at higher risk for diabetes. So I had to do something about that. So regular exercise. I got a COVID dog so that I'd have to walk with the dog, avoiding highly processed foods, trying not to eat out, trying to eat foods that you prepared yourself so that you can watch your salt intake, and not eat a lot of processed foods, which always have high sodium contents, high salt levels, and avoiding empty calories. And, at our age, we all know what those are, right? It's that candy bar, it's that extra glass of wine. It's things that don't have any real nutritive value, but certainly are tasty. So when you have diabetes, how do you prevent progression to complications? So you have to do all that stuff in the first, in that first section. You have to do all of that as to the extent that you can. You should consult with a nutritionist, and that's a benefit in your plan to help manage your blood sugar. You need to see your doctor regularly and follow recommended testing. So your doctor will help you understand what regularly means. It might mean once a month to start. It might mean once a quarter. It might mean twice a year, depending upon how well you're doing and whether you have other medical needs that also need to be attended to. And it's really, really important to take your medications and get immunizations as prescribed. As diabetics, people are more prone to and susceptible to infections that can be prevented by immunizations. And they have worse outcomes if their diabetes is not well controlled. So those immunizations and the medications that your doctor has prescribed are important. If you're having problems with the medications or those immunizations, you need to have a conversation with your doctor so that you both can make an informed decision about what's necessary for you to continue to live your best life. So the bottom line is, if you have diabetes or a predisposition to diabetes, you need to watch your lifestyle, and see your doctor as frequently as they'd like to see you. Next slide. Okay, so this is the fun part. This is the part where I get to tell you about what the services and benefits are to help you manage or prevent diabetes that we have available, because we think it's so important for our seniors to stay and be healthy. Next. So we have 2 online resources through WebMD, which is a well thought of, solid source for medical information. One is called Daily Habits, and you can get into it with your My Security Health Plan account on the portal. It gives you self-guided lifestyle and some tips about managing chronic conditions. And then there's an app. So if you like phone apps, I certainly do. There is one that will help you with positive lifestyle changes. It's also available through your portal to download that app, and you can set goals and track your progress. Because I'm a scientist, basically, if I don't measure it, I don't see it. So I need to set goals. I need to track my progress. I need to see how well I'm doing. So I like apps like that. Next. So we have extra support. We have a vendor that we use, someone who helps us with a virtual digital health program. So this is for people who are predisposed to diabetes and need help with lifestyle changes, or for people who are diabetic who need support. So it helps with there are coaches that help with weight loss goals, managing your diabetes, and improving your overall health. So you'll notice that so far we have overlapping tools between WebMD and Omada, and it's really your personal choice and what fits with you and your lifestyle. You get a free blood sugar monitor and test strips and a smart scale in order to track your progress. And you get to work with a certified diabetes care and education specialist. The URL, the address for how you access those on the internet, those services are listed on the last line. Omada has been a good partner. We've had we've tracked the weight loss progress of our members, and we have our membership has lost thousands of pounds using this program. So we know it's successful for some people. Next. Okay, so remember that exercise thing I talked about earlier? I hate to exercise, so I need a program, therefore the dog. But we have a Silver Sneakers program that is available to you free. There are 200 online workout videos, so you can do live classes and workshops. There are tuition rewards. Your membership is at no cost, and you can look up on their website to see what local fitness centers are in it. Usually all YMCAs are included in that membership. And so it's available to use. All of the ways to get started are available to you in in that little gray box. So another source of places to help you support your healthy lifestyle. Next. We also have care managers. We have nurses at the health plan that are available to help you and listen to you and work with you about how you make your insurance benefits work for you and how to access the medical system as you need to. As part of that, we also have a list of community resources, which includes diabetes support groups and other things that you might find helpful. That's on our portal as well. You can click on it on your computer and you can search by whatever you need, whether it's help finding healthy food or diabetes support groups or other community groups that are in your location or close to your location that can help you. You can also call customer service, or you can go directly to Manage Your Care, which will get you in contact with someone who will call you and spend some time talking to you about your needs. Next. So we also have health coaches. So if you want help with any of those dot points, weight management, quitting smoking, always the best choice, physical activity, healthy eating, stress management, you can also have a personal health coach from us. And those are available just by calling customer service. Next. Okay, so let me talk about a couple of other things. So you know how President Biden's been touting his $35 cap. Well, Security Health Plan has had a $35 cap for insulins, if that's what's prescribed to you by your doctor, for a long time, maybe 10 years or so, because we know how important it is to maintaining your health. We also have no copay, you pay no money for diabetes testing supplies, such as test strips or continuous glucose monitors that you might be prescribed. And if you're interested about your insulin in particular, you can go to RX Perks again at our website to view the list of insulins that are covered. And then you can have a conversation with your physician if you're currently prescribed one that's not covered. Most insulins are fairly interchangeable. There are different types of insulins, some long-acting, some short-acting. They're not interchangeable, but within each of those classifications, there are multiple insulins that are available for you to use. And so it might be worth a conversation with your physician if you're not on a list of those preferred insulins. Next. We also have a program that is more general than diabetes, but I wanted to talk about it here. It's a free service that we engage from a program called My RX Savings. That's a free service to you. You may receive a personalized alert with savings opportunities. They will work with your doctor to make sure that the switch is appropriate. And so you may save money on your pharmacy costs, and you can get consultations with pharmacy experts. It's very easy to use. And all you have to do is follow the address at the bottom. So My RX SS Security Health Plan Medicare at the bottom of the page to activate that service. And if you're on a bunch of prescriptions, it may be very helpful to you. Next. All right, so I have reached the end of my content. I hope it's been helpful. I'm happy to take any questions that are outstanding. I haven't been following the chat because I've been focusing on what I wanted to say. So please feel free to ask any live questions or put them in the chat box, and I'm happy to answer them.